My name is Professor Marie Carney. I am the Dean of the Faculty of Nursing and Midwifery in the Royal College of Surgeons. The Faculty of Nursing and Midwifery was formed in 1974 by Mary Frances Crowley, who was the Director of Nursing, or Matron as she was called then, of the Eye Hospital in Dublin. Miss Crowley was a very inspiring nurse who saw the advantages to educating nurses and midwives to a higher level than previous, and the advantages that this would bring to patients, to the hospitals and to nurses themselves. The Faculty of Nursing was inaugurated with 120 nurses in 1975 and a further 120 nurses in 1976. And these nurses were very important in providing financial support to the Faculty of Nursing, but also in allowing their students and their nurses to come to the Faculty of Nursing to study modules that were not available anywhere in this country. The Faculty of Nursing is governed by a board, and that's comprising of the Dean and 13 members of the board, all of which are elected by Fellows of the Faculty of Nursing and Midwifery. The first fellowship of the Faculty of Nursing and Midwifery was awarded in 1976 to 20 students. And it was quite an arduous process at that time to obtain the fellowship. Nurses had to undertake 6 modules here in the faculty. They had to undertake a research project based on their practice, present this in a viva, and then also undertake a clinical examination of a patient in their clinical area. We have made it easier for students now because we take cognizance of the level of education of nurses today, the level of experience, of management and of clinical practice that they have had. So now nurses must undertake a research project and undertake a viva and submit a portfolio. The faculty also presents Honorary Fellowships, and the first Honorary Fellowship was presented in 1992 to Mother Teresa of Calcutta. Honorary Fellowships in the Faculty of Nursing and Midwifery are awarded to individuals who have provided an excellent contribution to society. Others who received the Honorary Fellowship were President Mary McAleese while she was President, and others such as Patricia Benner, Dr. Therese Mahan, who were educationalists, and also social activists like Sister Concilio, Alice Leahy, Mary Davis, to name but a few. And the final fellowship that we award is the fellowship by Addendum, and this is awarded to nurses and midwives who have made a significant contribution to midwifery and nursing. The Nursing Review was formed in 1981 and was presented by Professor Pearl Tracy for 10 years. And the Nursing Review Journal came about from the development of the annual research conference, which started in 1981. And we have continued every year since then with a research conference. So it's the longest running research conference for nurses in this country. Baroness McFarlane was the first speaker at the first international conference. We have other very famous names delivering, such as Virginia Henderson, Professor Kath Melia, Caroline Fitch, Philip Derbyshire, and others from around the world. The themes of the conference in the early stages were very broad, but in recent years the theme has become more specific, must be research-based. We encourage our students to present at the conference and also to develop posters, which they also present then. So we have continued with the research theme, which started with some of the early speakers where they talked about the importance of developing research for nurses and nurses becoming active in research. The Faculty of Nursing and Midwifery has run education courses for nurses in this country since 1971, prior to the inauguration of the faculty in 1974. These programs were delivered through modules, and some of the modules were titled Anatomy, Physiology, Pharmacology, Sociology, Psychology, and Research for Nurses, and they were very well contributed to. The faculty then, through the academic staff working in the faculty and in the school, developed further programs, starting with the Diploma in Nursing Administration, the Bachelor of Science in Nursing, Bachelor of Science in Management, and from there to postgraduate diplomas are delivered in collaboration and consultation with our partner hospitals. Each programme has a research focus. We developed master's programmes in leadership and nursing, and a few years ago developed our first masters in nursing and advanced practice in the areas of neonatology and epilepsy. Many of our students are international students, so therefore we have a very international focus throughout the programmes that we deliver. We try to look after our students. We welcome them coming to the Faculty of Nursing and Midwifery. We hope many more will come in the future. And we try to deliver our programmes in a manner that is innovative, that allows the student to obtain knowledge, to access our programmes through distance learning and through technology. We believe that these programmes have contributed significantly to the development of nursing practice and to excellence in patient care.